Just a very quick presentation on never events in UK hospitals. So what is a never event? Well, it's obvious, something that should never happen. But it has a definition. The definition is it's a serious incident that's wholly preventable because national guidance and safety mechanisms exist at a national level that produce strong protective barriers that should stop them from occurring. Serious incidents wholly preventable as national guidance and safety mechanisms exist that produce strong protective barriers to stop them from occurring. There's a list of never events. Surgical never events: wrong site surgery, wrong implant, retained product, medication errors, wrong route of administration. Think about those intrathecal drugs every now and again. Misselection of a strong potassium strength containing solution. That's why the 60 millimole bags of potassium have gone from the wards. Misselection of high midazolam strength. That's why now it's only 1 milligram per mil, largely in most hospitals. Overdose of insulin through either a device error or through misprescribing. For example, the international units can be misread. Overdose of methotrexate and an incorrect ABO compatibility to blood transfusion. In mental health, not using collapsible curtains when there's a suicide risk, and general risks would be fall from a window, entrapment in bed, feeding a misplaced NG tube, and scalding injuries. I would like to try and think of a mnemonic to remember these, but I can't. Surgery, WWR. Drugs, you might be able to get something like brimp commit from it, but honestly I think we just remember them. Just try and think about things that are not supposed to happen. Okay, thanks very much. Okay, now we're going to talk about the factors that might lead to medication errors, and the way I'm going to remember this is we're going to win if the team can pass. Medication factors are win, weight-based, infusions, and number. So weight-based calculations can lead to errors, drug infusions can lead to errors, and high number of medications can lead to errors. In the environment, talk about high staff turnover, patients admitted as an emergency, patients that are acutely unwell, kind of go together, those two. And M is multiple team members, so frequent handovers. Patient factors: patients with prolonged stay stands to reason they're high at risk, just by the fact that they're exposed to more medication administrations. Older patients, they're less likely to be able to tell you what they're taking, or more likely to make errors in what they're telling you. Sedated patients are less likely to tell you you're giving them the wrong drugs. And patients who are severely unwell, probably because of the fact that they'll have on numerous medications, they'll be on drug infusions, and they're probably going to be unable to tell you why what you're doing is wrong. Just going through that again: medications, weight-based, infusions, and number. That's win. Environment is team, and that is high turnover of staff, emergency, acute admissions, and multiple team members. Patient factors are pass, which is prolonged ICU stay, extremes of age, sedated or severely unwell patients. Okay, just to talk now about electrical safety. So the risk from electricity is that it can electrocute you directly, it can cause burns through heat generation, or it can ignite other flammable substances, which kind of then leads to a burn, but hey ho. Factors affecting the electrical injury that can occur: current, higher current, the pathway, so if the pathway is long it will cause a bigger injury. Current density, so if the current is condensed into a smaller area it will create more heat. Alternating current versus direct current: alternating current is much worse. If it passes through an organ that's susceptible to electricity, such as the heart, then it's more likely to cause injury. And the longer the duration, so I haven't got a mnemonic for that, but code up, current, pathway, density, alternating current, organ it goes through, and the duration of the injury. Just quickly talking about electrical classification: the class system. Class 1 is an earthed circuit. Class 2 is a double insulated, so that there's no ability for anything electrical to reach a user's hand. And Class 3 is a low voltage device. Type is defined by leakage current. So type B is there's a low leakage current. Type BF is that the patient is isolated from Earth, so that if there was a leak, it won't go through the patient. It will still need to go back through the circuitry. And then type CF is a floating patient and an ultra low leakage current. I think less than 0.05 milliamps. So it's suitable for use with suitable use with direct cardiac contact. Okay, and there ends the presentation. Thanks very much.